I am absolutely happy to give the floor to Dita Erna Sīle, board member of AmCham Latvia, with the closing remarks, and definitely it serves a wonderful composition of our day, because initiative takers, initiative givers, AmCham Latvia, without you we wouldn't be here. The floor is yours.
Thank you so much. So it's my honor to offer the closing remarks for this wonderful event as a representative of American Chamber of Commerce in Latvia, or AmCham, where I serve as a board member and lead of the Healthcare Working Group. It has been our honor, and we are delighted that we have been one of the organizers of this event, highlighting digital transformation in the healthcare. AmCham serves as a thought leadership hub for American and international businesses here in Latvia. We are a leading foreign business organization with approximately 140 members, some of them largest international companies in Latvia. And this is why, in our view, human capital is one of the most critical areas in order to attract and retain high-value investment in the country. Availability of talent is also of utmost importance to ensure sustainability and economic growth of the country. Therefore, one of our policy priorities is to improve health outcomes for Latvian society. This is why our healthcare working group within the AmCham is working in a number of directions. We have rendered our recommendations for digital health strategy in Latvia, and also we are supporting this flagship Digital Health Summit. Also, as one number of experts today on the stage talked about secondary use of health data, we are also honored to support creation and implementation of legislative framework for secondary use of health data in Latvia, together with a number of other stakeholders. We also believe that predictable state budget for healthcare, aiming to reach EU average, is of utmost importance to reach both increased life years and quality of life of Latvian people. This is why American Chamber of Commerce recently published our position paper on sustainable healthcare financing, and we are calling government and society to support necessity for investments in healthcare and reforms in healthcare that would also allow for new technologies and digital solutions to come into the life. Current pandemic has also amplified the need for data, both for public health policies as also to remove inequalities and ensure equal access for all patients and early access for all patients into our healthcare system. It is clear that access to significant amount of high quality and representative data, together of advanced technologies that we were talking about today, can lead to better outcomes to our patients and value-based healthcare. Today's summit has been an exceptional resource to facilitate patient-centered digital healthcare strategy based on international experience. It has been truly inspiring to hear a number of best practice examples of digital solutions across Europe and United States, how we can bring better solutions to our patients earlier. It was also particularly enlightening that a number of those fabulous examples were actually coming from Latvia that we also heard today on the stage. And this is why it brings that only all of us together can build trust and ecosystem which is open and inviting for new technologies and innovations. So this is also our call. Let's work together in one ecosystem to build this trust. State institutions, healthcare institutions and professionals, patient organizations, and industry stakeholders, because we have common aim to create value for our patients. With this, I also would like to thank participants, organizers, co-hosts, and sponsors of the event. Special thanks go to the Minister of Health, Mr. Daniels Pavļots, and Minister's Advisor, Mr. Kaspars Bērziņš, as well as Director of National Health Service, Mr. Āris Kasparāns, for your commitment to this event, especially during these challenging times, as we also saw today in the changing agenda. I would like to personally thank American Chamber of Commerce Healthcare Working Group and our supporters that made this event possible. Co-hosts of this event, Roche and Mr. Rauls Vēliņš, General Manager, Novartis Baltics and Theodoros Vasiliou, General Manager and Country President Baltics, Microsoft and Ruthi Kaider, Health Industry Lead. Also our partners, Janssen and Signe Veling, External Affairs and Market Access Lead for Baltics, and Medtronic and Andrius Grigošaitis, Country Leader Baltics. And also our wonderful sponsors, AbbVie and Gunte Nussbaum, Regional Finance Manager Baltic States, as well as Amgen, Andrius Rudzikas, Country Director Baltic States. I thank you indeed in the name of the organizers. It wouldn't have been possible without your support. We hope that today's summit will build towards data-driven, personalized, and value-based healthcare here in Latvia and in foreseeable future as well. So AmCham stands committed to support improvements in Latvian healthcare systems that put patients in the center. So thank you for your attention, and I hope that we will have an opportunity to continue our collaboration in the future as well. Thank you all.